So this is the submandibular region. The submandibular region, it is present just below the mandible. So majorly there are suprahyoid muscles can be seen, and the major content is the submandibular gland. So this is a submandibular gland. The submandibular gland have got a superficial part and a deep part. It possesses a superficial part and a deep part. The deep part is continuous posteriorly with the superficial part. Deep part is a small part which is continuous posteriorly with the superficial part. This is the superficial part which can be seen from externally. This is superficial part. It is resting in relation with the mandible. It is resting in relation with the mandible. So the submandibular superficial part is nicely can be seen in this. This is the superficial part of submandibular salivary gland. This possesses three surfaces. This is inferior surface or the superficial surface. This is the medial surface. This is the lateral surface, and this one is the medial surface. Superficial surface, lateral surface, and the medial surface. The superficial surface or the inferior surface. Superficial surface or the inferior surface, that is the surface which covers with the skin superficial fascia containing platysma with the cervical branch of facial nerve, being it is the external most surface. And this is the lateral surface. The lateral surface related with the submandibular fossa of the mandible. It is related with the submandibular fossa of the mandible and the medial pterygoid muscle attaching to it. This is the angle of mandible. Here comes the angle of mandible. So the medial pterygoid muscle is inserting to the angle of mandible, and the stylomandibular ligament which is attaching to the angle of mandible. So these are the structures comes in direct contact with the lateral surface. And the medial surface is the underlying surface or the inferior most surface. So the medial surface comes in direct contact with the mylohyoid muscle which is forming as the floor of the mouth. The mylohyoid muscle and the vessel which is named as a submental artery. Mylohyoid muscles and nerve which is supplying it. And the submental artery can be seen, which is the branch of the facial artery, passes in this position. I will show you the submental artery. So this is the superficial part of the submandibular salivary gland. This is the external surface, superficial surface or the inferior surface, and this is the surface which is named as the lateral surface. So here in the lateral surface it is related to mylohyoid muscle which is forming as the floor of the mouth. This is the mylohyoid muscle, and here we can see the facial artery can be seen. So from the facial artery, one branch which is passes, that is a submental artery. So this is a submental artery, comes in direct contact with the medial surface. Comes in direct contact with the medial surface, it is resting over here. So this is the structure, submental artery, and here is also the floor of the mouth which is forming the mylohyoid muscle. These are the structures which are relating on the lateral surface. Relating on the medial surface which is present towards the internal aspect. And here it is resting over the mandible. Here is also comes in relation with the facial artery. Facial artery indented on the lateral surface. The lateral surface resting over the mandibular fossa. Lateral surface resting over the mandibular fossa, and there is the muscle which is attaches to the ankle of mandible, that is removed from this. Is a medial pterygoid muscle can be seen at the angle of mandible, and the stylomandibular ligament can be seen, and the facial artery, it is resting deep to the surface of the parotid gland. That is, all these things can be seen in relation with the lateral aspect. And the medial aspect again can be divided into three. This is the medial aspect. The medial aspect again can be divided into three: anterior part, middle, intermediate part, and the posterior part. So I'll show you the structures which can be seen in relation with it. It's not surely seen all the structures, but some of the structures are visible. So I will show you what are the structures can be seen in relation with the medial surface. First one, mylohyoid muscles, nerves, vessels, and submental branch of facial artery. So mylohyoid muscle forming the floor of mouth. This is mylohyoid muscle. The nerves and vessels which are supplying it cannot be seen in this picture. And this is the submental artery. The second relation, the submental artery, the branch of the facial artery can be seen. Intermediate part is related to hyoglossus, styloglossus, lingual and hypoglossal nerve. The intermediate part is related to hyoglossus muscle. This is the muscle hyoglossus. Hyoglossus muscle. This is the hyoid bone. From the hyoid bone to the tongue, the muscle is passing. That is the hyoglossus muscle. Hyoglossus muscle. Over the hyoglossus muscle, we can see the hypoglossal nerve. The hypoglossal nerve can be seen in relation to the hyoglossus. And like that, the lingual nerve which is coming from the infratemporal fossa, the lingual nerve can be seen. The lingual nerve which is passes deep to it. On the medial aspect, the hypoglossal nerve can be seen in relation with it. The hyoglossus muscle deep to hypoglossal nerve. You can see the hyoglossus muscle and the styloglossus muscle. It is removed. It can be seen on the deeper relations only. Here it is cutted. So these are the structures which can be seen at the intermediate part. On all the structures which can be seen in the posterior part is the deeper structure. From the styloid process, there is towards the tongue there is styloglossus muscle, and towards the pharynx there is stylopharyngeus muscle. So these are the structures which you have to identify in the submandibular region. So this is submandibular superficial part, and here we can see the deep part. This is the deep part of the gland. It is continuous from the mylohyoid muscle. This is superficial part and this is the deep part of the gland. Both are interconnected and continuous each other. So that is all about the submandibular salivary gland, the identification. See, in relation with the superficial part, there is facial vein can be seen. Facial vein superficial to it, facial artery deep to it. And over that, the facial vein passes to form the internal jugular vein, communicating with the anterior division of retromandibular to form the internal jugular vein. Opening to internal jugular vein can be seen in relation with it. These are the superficial structures. Also, there is the presence of lymph nodes also can be seen in relation with it. You can see the lymph nodes. Superficial submandibular lymph nodes can be seen. A small nodule, lymphatic nodule is present in relation with, see, these nodes. These are the lymphatic nodules. Small bean-shaped structures can be seen. This one. So that is all about the submandibular salivary gland. Submandibular salivary gland.